Hello everyone, my name is Hector and I'm a medical surgical nurse. After watching Chasing Zero, my first thought was, honestly, how fragile patient safety can be. When everyone is trying their best, it made me reflect on how often harm in healthcare isn't caused by the lack of caring, but by systems that quietly make safe care harder to deliver. One of my biggest takeaways is that preventable harm usually doesn't happen because one person failed. It happens when small gaps in communication, workflow, or staffing started to add up. Over time, those gaps create an environment where mistakes become likely, even with the experienced, committed nursings at the bedside. In my own practice, I've recently seen how this can play out during a hospital expansion. As our hospital has grown and taken on more patients, staffing hasn't always been able to keep up at the same pace. Some nurses are newly hired and still completing training, while experienced staff are often managing higher patient loads than usual. On a medical surgical unit, caring for 6 patients can be very challenging, especially when the needs are complex and constantly changing. For example, I might have 2 patients who schedule dialysis on the same shift, and that requires coordinating with the pharmacy, physicians, the dialysis team to clarify what medications should be given, held, or adjusted before and after the treatment. At the same time, other patients may need blood glucose monitoring, neuro checks, insulin administrations, timed antibiotics, discharge teaching. Family might have other questions, and ongoing safety education. Each of these tasks is important, and each one takes time and focus to safely deliver throughout. What this video made me realize is that these situations are not just busy shifts. They are potential accidents waiting to happen. If the system does not adequately support the workload, when the nurses are stretched across multiple high acuity needs, the risk is not just physical fatigue, but cognitive overload. Important details can be delayed, and the delay can impact patient safety, even when nurses are doing everything they can. Sharing stories of errors or near misses, whether on our own or those highlighted in the video, changes how we practice. It removes the idea that errors are personal failures, and instead, it encourages us to ask, what in the system allowed this to happen, and how can we prevent it next time? The mindset creates a culture where we are more vigilant, more transparent, and more committed to improvement rather than blame. One practical strategy to reduce harm during times of expansion would be temporary use of agency staffing until newly hired nurses complete their orientation and feel fully confident in their roles. This could help stabilize nurse to patient ratios and allow bedside nurses the time they need to coordinate care, educate patients, and anticipate risks before they become actual harm. Ultimately, Chasing Zero reminded me that preventing healthcare harm is not about expecting perfection from individuals. It's about designing systems that make the safest action the easiest one to take. As nurses, we are in a unique position to recognize when those systems are strained and to advocate for changes that protect both our patients and our colleagues. Thank you.